take the roll call if you would, please, Jeffra, so we know who's on the call.
Sharon Hansen,
Here.
Gino Rusi,
Here.
Jen Persico,
Here.
Ron Bennett,
Mr. Bennett is connected.
Here.
There it is.
I'm gonna say, I saw him get on.
I'm on.
Scott Boleski,
Here.
Ron Chapin,
Here.
Darby Fishkin, Katie Grimm,
Here.
Mike Hoffert,
Here.
James Lewicki,
Present.
Chris O'Brien,
Here.
William Pauly, Jack Quinn,
Here.
Mike Seaman.
Here.
Darby joined.
Pardon me?
Darby Fishkin has joined.
Oh, okay, thank you.
Okay, thank you, everybody. So we have a quorum. Unless we have any deletions, corrections, or modifications to the minutes, we'll dispense with their reading. Are there any? Thank you. Let's go right to resolutions. And I know, Counselor, we have a number of them all with your name associated with them. So item A is a resolution approving the annual review. Tony, if you would, please.
Yes, good afternoon, everyone. As those of you who've been on this board in past years know, we are required by the Authority's Budget Office and other state laws to review as a board and approve certain of our policies and procedures on an annual basis. Back early in March, and then again on the 18th of March, Jeffra was kind enough to forward to you a copy of our disposal of property guidelines, our investment policy guidelines, our mission statement, and our procurement guidelines. 3 of the 4 of those are not changed from last year. The investment policy, you might remember, last year was changed markedly. And this year there was a little bit minor changes that were proposed and approved by the investment committee with a recommendation that the board consider and approve them. Predominantly, that one change, the one substantive change to the investment policy involved the debt service reserve fund, which was set up initially as part of our investment policy, but the fund itself was never funded because it was never required in our bond covenants. And so the committee is recommending that we do away with the reference to it in our policy since it is not relevant any longer. Let me stop there because all of you received that packet of materials, answer any questions you have, and otherwise suggest that if there are none, the motion be made to approve the policies as presented.
Is there a motion to approve the annual review?
Motion by Mike Seaman.
Mike
It's
Seaman.
seconded
is
by
there-
Sharon Hansen.
Seconded by Sharon. Further discussion, questions, comments? If there are none, we'll come immediately to a vote. All in favor of approving the motion, please signify by saying aye.
Aye. Aye.
Aye.
And the contrary? That motion carries. Tony, we can go to the next 2, if you would, please.
I believe that Darby is going to present the audit report
Do we have
for
to do that
receiving
one
and
first?
filing by the board.
Do we have to do that one first?
We usually do that one first because the annual report contains the audit in it. And so if you approve it, then you've, by, I guess, implication, approved the audit as well. And that should be approved separately.
I was just asking to see if you were paying attention.
I hope so.
Darby, Darby,
Great.
if you would, please,
Sure.
on the
So on
annual
March 11th,
audit.
on March 11th of this month, we met with RSM and they presented the external audit of ECNC. So Steve Garvey from RSM presented our external audit. They gave us a clean, unmodified opinion. There was no audit letter comments. They did remark on how well the audit went and that it was done sooner than they had anticipated. They have not had that happen during COVID, so they were very pleased and had high remarks for John and his team. So I wanted to make that comment. Freed Maxick then presented kind of the status of where they are on internal audit. They pretty much transitioned everything over to the new internal auditor at this point. And unless there's any other questions, the audit committee recommends that the board approve the external audit report for ECNC.
Thank you, Darby. So the motion's been made. Is there, I don't know that it requires a second, but I'm sure that Mr. Colucci will correct me. So the second by Jen Persico. Any other questions on the audit for Darby or John? Seeing none, we'll come to a vote. All in favor of approving the audit, please signify by saying aye.
Aye.
And opposed? Thank you. And I would ask everybody to please keep their phones on mute if you're not otherwise speaking. So resolution number 3, Tony.
Yeah, thank you again, John. Those of you who have been on this board for many years know that the Public Authorities Law in 2 places, Section 2800 and Section 3642, require that Erie County Medical Center Corporation prepare and publish an annual report, which, among other things, contains a number of schedules that contain information about our operations, whether they be capital projects or accolades, commendations, certifications, our bonded indebtedness, salaries we pay to certain of our employees, and of course, our financial statements and the external audit, which you all just received and filed, thanks to the work of the audit committee and John and his staff and our external auditors. That report is a lengthy document. We transmitted it to you several days ago so that you'd have a chance to review it. It will, after approval by the board, be filed with a number of folks, you name it, from the office of the governor all the way down to various offices within the county government. And it'll also be published with the Public Authorities database, so-called PARIS. It has to be filed by the 31st of March. Unless there's any questions, which I'm happy to answer if there are, or John is, I'm sure. I guess the chair should call for a motion to approve the annual report as presented.
Motion has been made by Congressman Quinn. Is there a second? Second by Jen Persico. Now, any other questions, comments? Once again, we'll come immediately to a vote. All in favor, please signify by saying aye.
Aye.
And opposed? Thank you. That motion carries as well. And the next one on the compliance plan, Tony.
Yes, thank you. Those of you who are familiar with healthcare understand that compliance is an important part of what we do every day. This organization has had a compliance plan, a comprehensive one, for many decades, actually, for as long as it's been in existence. But periodically, we find the need for it to be updated so that it stays organized in accordance with federal regulations and federal guidance, as well as state guidance. And in addition to that, our compliance staff, headed by Nadine Munn, has come up with a very comprehensive code of conduct, which is something that we've worked on and kicked around for a very long time, with a lot of input from staff to make it as not only readable and practical, but as tuned as it can be to the operations that we undertake. Those 2 documents were transmitted to all of you for review prior to today's meeting. I asked Nadine to tune in to this meeting, and you might see her on your screen in the event that you have any specific questions about the plan or the code of conduct. But if you don't, then I guess the chair would entertain a motion to approve the compliance plan and code of conduct as presented.
Thank you, Tony. Motion's been made by the basketball playing Chris O'Brien, seconded by Gino Lucy. Further questions, comments? Great. All in favor of approving that motion, please signify by saying aye.
Aye.
And to the contrary, that motion carries as well. So thank you for doing all of that. And and I'll say it a couple more times during the course of the meeting, the fact that the audit went so smoothly, given what's gone on during this COVID time and all of the intricacies of our budget and budgeting. John Swai, great job with you and your staff and getting that done and having a clean audit. So that is spectacular. So congratulations, and let's continue in that vein. So well done. Dr. Cummings on a medical dental staff meeting.
Thank you very much, John. I have several items for the board's review. In your packet is the MEC minutes from yesterday's meeting. Within that is the credentials committee meeting. We had 12 resignations, 8 initial appointments, and 33 reappointments of staff. Like to take a special note for Dr. Kenneth Garbardino, who has joined Terrace View staff and is a very welcome and needed addition there. 2 items were voted on by the MEC yesterday. One was a change to the credentials procedure manual that is actually a really welcomed regulatory change in requirements that physicians and medical staff no longer have to have PPDs every year. And there's a different way of screening for that will make everyone's life a lot better and makes a lot of sense. And the other piece is to the a vote for the the professional policy ADM 026. I'm sorry, I can barely see what I have written over here, which is basically voting in the bylaws of Leadership Council, which is part of the peer review committee, which is long in coming and is there for your review so that we can move forward with the Horty Springer guidelines that we have developed over the last several years. So that is what we have there. The only other thing I would like to say to the board is we also are very grateful that Dr. Matthew Ruggieri has decided to become the chair of the Wellness Committee. And I think he is a very welcome addition to that. And just wanted to have the board know that that change has been made.
So our physicians have a wellness committee.
We've had a wellness committee for some time, and it's been under the leadership of Dr. Grimm in the past and other people prior to that. And I think as we're moving forward with peer review and being a very diversionary process and helping support our clinicians, the wellness committee is a vital piece of that. And Dr. Ruggieri is from behavioral health. For people who don't know, he's a psychiatrist who's worked in CPAP and now inpatient, and really has stepped up and been very interested in this role. And I think it's now more than ever is extremely important. And I think he'll be a very nice addition in that leadership role.
So Dr. Cummings, the purpose of the committee is to function on physician wellness, correct?
Absolutely. And of course, we look at physician, medical staff, wellness. So this is NPs, this is PAs, this is the entire group, but it's part of a larger cultural change, I think, of not simply having mechanisms for punitive responses to behaviors that need to be addressed, but also having mechanisms to look independently at individuals who may need additional support that can be referred there from the leadership committee. Also, that can self-refer, and it's important. And Dr. Ruggieri is a very thoughtful younger attending who has been actively involved in several mechanisms within ECMC, and I think will provide really good leadership there, along with Dr. Pugh, Dr. Panesar, several other individuals on that committee.
Great. Thank you, Dr. Cummings. Motion's been made by Dr. Cummings to accept the minutes of the medical dental staff. Is there a second?
Second by Mike Seaman.
Thank you, Mike. Any other questions for Dr. Cummings before we proceed? Seeing none, we'll proceed to a vote. All in favor, please signify by saying aye.
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 And opposed. Thank you, and thank you, Dr. Cummings. Dr. Quattrochi, CEO report, please.
Thank you, John. Hello, everybody. Jeffrey, if you can put the slides up. Okay, thank you very much. Before I start, first of all, I would like to just thank the entire board for your participation in the two diversity and inclusion sessions, and thank Yvonne and Cindy Bass for their wonderful program they put together. But I hope you found it to be valuable, and you experienced exactly what the ECMC family experiences, and I appreciate you taking the time to do that, and I appreciate your leadership in wanting to do that. so that we can show the organization that, we value diversity, equity, and inclusion at ECMC. So thank you. And also, just I wanted to mention, Dr. Cummings was talking about the Wellness Committee. That was an effort that was really spearheaded by Dr. Grimm when she was president of the medical staff, and has carried on, and Dr. Cummings is now taking it to another level. But I want to thank Dr. Grimm also for her leadership in putting that together. Okay, go ahead, Jeffrey. So just obviously an update on our COVID patients to date. We have 969 COVID patients that we've treated. Average length of stay is about 14 days in 2020 and is down to about 12 in 2021. Obviously includes individuals who are in the ICU. Patients currently in house are 25, 4 of whom are vented, 0 patients under investigation, and we've done 132,959 tests, and we've also done a tremendous amount of vaccines also. Go ahead, next slide. So there you go. That's the COVID-19 vaccine center and the individuals who've been helping with that. I think we're up to about 16,000 vaccines that we've done, and the team has just done an unbelievable job with that under the leadership of Jim Turner and Casey Davis and Lucia Rossi, and you can see others in there who have worked, even Andy Davis in the back there. Everybody's really, in all seriousness, taken a really big leadership role in vaccinating not only the ECMC community, but also our entire community. Next slide. So this is how many vaccines we've done. Actually, it's 17,000 vaccines that we've done, and you can see the different brands in which we've vaccinated. Next slide. Under quality, wanted to keep the board updated and continue to look at some of the indicators, and we'll expand this as the data goes on for the year. But you can see with our catheter-associated urinary tract infections, our central line infections, and also our MRSA infections, where we're at as of year to date. We're a little, I guess, further along with some of those cases than we'd like to be. So we're going to have a continued focus, but you can see that obviously the COVID patients and the increase in COVID patients can contribute to that. Next slide. Very proud to announce that our orthopedic division actually this year is named in the top 10% in the nation for overall orthopedic services. We also have been a 5-star recipient for the past past 11 years for hip fracture. And this is a testament not only to the orthopedic department, but the whole continuum of care from the moment a patient comes in through the emergency room to surgery, to the floor where they're cared for, and many times, because patients are older, the medical attention that's given to them all the way to physical rehabilitation and subacute. So this is really a testament to the entire continuum of care for these patients. So just a congratulations to orthopedic department and all the different services who touch that department. Next slide. Institute for Healthcare Improvement. We are participating in becoming an age-friendly health system and in participating in a process. It's a national initiative for that. We also just recently had a clinical learning environment review visit. We have not gotten the report back from that. It's not an accreditation. It's more of the ACGME looking for improving the learning environment. We participated in that, and I participated in that along with other members of the leadership team and leadership from the university to assist in that process. Next slide. Patient experience, again, continuing to monitor our scores. We are, as you can see at the top, the N number is lower than typically it is during that time period. So we're working on that to make sure that individuals know that they need to fill out that survey to give us feedback, and we're continuing to do that. I think many times individuals will write us very nice notes and think that that's their feedback to us. So we're working on a program to make sure we get more participation in our surveys. Next slide. Under culture, this month we celebrated World Kidney Day, and again using our new sign to do a lot of different celebrations this year. Next slide. We're celebrating National Women's History Month throughout this month, and we are sending out various inspirational quotes from women leaders, as well as other programming that we're putting on. And actually, we're looking to put on a program with the women from our board, and actually at the end of this month, and for the entire hospital community. So thank you for agreeing to do that. And we'll hopefully have that scheduled in the next few days. Next slide. Also celebrating our social workers. It's National Social Worker Month. Next slide. We're celebrating Doctors Day on March 30th. So we're obviously doing that virtually, and we're very, very proud of our doctors. And next month I'll kind of report out on some of the folks that were the doctors that and extenders that were chosen by the nurses to recognize them for their extraordinary efforts. Next slide. Go back. We had a celebration, a virtual one. It was actually very well done. Sue and her team did a great job, along with Karen Zamansky, celebrating our 83 scholarship recipients. This is both for certifications and individuals continuing on for education. The nurses who receive this scholarship are very grateful for the support of the foundation, and thank you to everybody on the line here who supports the foundation, because this is your dollars at work, making sure that we advance people in the organization into nursing, or if they're in nursing, improving their training and their skills. We also had a retiree celebration. We actually usually have this obviously in person. We delivered a gift to everybody's house, and we got a lot of great feedback. I can't believe you still remember me kind of comments. And it was really a nice event, and it was a nice chance for the retirees to talk about what they're doing now and get a chance to thank them for their contribution to ECMC. So many individuals who've been here 30 and 40 years. Again, I mentioned the women's panel that we're going to have for recognizing Women's History Month. We also had another ECMC clothing sale, and it continues to boggle our mind. We sold $35,000 worth of ECMC logoed apparel. Obviously, just another testament to how proud people are to work here, to reach into their pocket and buy clothing that has ECMC logo on it. And people got really excited about that. It was very well attended. And then finally, we have our meat raffle, which is always a lot of fun. We did it virtually this year to benefit nursing, and it was very, very successful. Next slide. I'd like to congratulate Donna Gotti, who works in CPEP. So she was entered in the National Women's Hall of Fame book of Lives and Legacies for March Women's History Month. Donna is an absolute star here. And for those of you who have interacted with Donna, she is what the ECMC culture is all about, and does an unbelievable job at CPEP for our patients and their families. Next slide. I'd like to introduce Dr. Mary Kamiya, who's the new chemical dependency physician here at ECMC. We're very happy to have her joining us. Medical surgical expansion. We've actually expanded some of our medical surgical capacity in light of the fact that we've just been so busy. Even without COVID patients, we're seeing a lot of medical patients, and the ER is continuing to be very, very busy. We actually finished some forensic safe rooms. So we're again, our program to take care of those who are involved in violent crimes. We're very happy to have those rooms taken care of. Kronos app, that's an app. We're trying to get into the 1990s, I like to say, with some of our HR functions, and to actually do things via our phone here, and rather than either by paper or by the computer, so that people can check their own time. And we piloted that project, but I'd like to thank Joe Gillia and his team. They've done an unbelievable job in this project to get us to a point where people can access their information a lot easier. And then finally, we're starting the roof project. The roof project is a big project, and we've had a lot of issues. We actually have rooms offline right now because of it. And I want to thank Jim Turner and his team for getting that project moving. Next slide. So you'll see the February statistics. I don't think it's any surprise. We continue to see, obviously, our discharges down slightly, mostly due to fact that it took us a while to get inpatient surgeries started again. And because you'll see down at the bottom of the chart where it says admissions via the ED, we are actually up on admissions to our emergency department, but down in overall discharges, and that's directly related to that inpatient number you see under general surgeries, where we're down 25% in February. So we're beginning to see that pick up and get cases scheduled. We also are seeing a little bit of out-migration in orthopedics to outpatient centers, but I think that'll be soon mitigated by some new individuals that are joining us. And again, continue to monitor our length of stay. Continues to be a challenge with COVID, but teams done a very good job of continuing to manage length of stay in the rest of the house. And our outpatient visits, as you can see at the very bottom, are continuing to grow. So with that, I'll ask if anybody has any questions, and if not, turn the presentation over to John for finances.
Tom, before we have John speak, could you talk a little bit about how busy the hospital is, where all that is coming from, particularly as it relates or doesn't relate to COVID? I think it would be important for the board to understand what the nature of that daily census is all about.
Yep. So I think, you really, if we look at the COVID patients as kind of additional patients, we have, consistently 2 units of additional patients. Right now we had in the 30s last week, and now growing into the 30s beginning of this week, actually, now back down into the 20s. So if you think about it as additional patients, that can be 2 units or more, plus unfortunately ICU patients. So a lot of the volume, John, is really coming through the emergency department, as you can see, and that increase that patients are coming here that are sicker, which is obviously what we want, the reason for the emergency department versus a doctor's visit or urgent care visit. We're seeing more trauma. We've seen more trauma this year. And we're also just seeing folks that may have let things go a little longer than they, frankly should have.
And that's as a result of COVID not wanting to come?
Correct. And, and I think, frankly, we're up, as you can see, a little bit in our ED. Many of the community emergency departments are down in volume right now. So frankly, I think the new emergency department has helped in that regard. I think the word's out. And so I think that's a benefit for us, as well as some, obviously, the other efforts that we're doing to educate the community on the services here. But it really is the emergency room volume, John, that's driving how busy we are, but also that length of stay, right? So you see patients that are sicker, and obviously you have COVID, but you see patients that are sicker, and we have a little higher length of stay. So that, if we're not discharging people as quickly, we'll see census above 500. And we've seen that more than a few times in the last 30 days or so.
Thank you, Tom. Any questions for Tom before we move on to finances?
Yeah, Tom, Mike Hofford here, Tom. In regards to the volume in the ED, are we finding that some of these people are new to the ED and they like what they see and they've been there more than once now? I mean, because it is surprising the volume that has really gone through there. And I know that we made very conscious efforts to be able to move the people through there. And how is that? I mean, what is, from the time they enter to the time that they get into a bay? I know my own experiences, it's been pretty quick. I mean, are we, watching those times and that type of thing?
Yes, absolutely. And frankly, the left without being seen number is the other number we watch very carefully. It's been a little challenging because the tower has been so full, frankly. And we have, patients holding. The good news is that patients now are holding in rooms versus the hallway like they used to. So that's a good thing. We'd love to get our left without being seen number down to 0. I would say it's gone down almost half. If you really have looked at the graphs of kind of left without being seen, and we've improved it significantly, but we have room to improve more. again, but when it does get backed up like that, the environment obviously is a lot more comfortable for patients, a lot more private than what we experienced before, which was patients, frankly, all over the place in the hallways, and we've all seen that, which is not a healing environment, as Dr. Cloud would say. So does that answer your question, Mike?
Yes, thank you very much, Tom. I appreciate that.
Yep. Thanks.
Any other questions for Tom? John, if you would, please.
Okay, thanks. I won't spend too much more time on this slide, but did want to highlight a couple of other things. So as community COVID numbers have gone down, so have ours. But in February, COVID cases were still pretty high. So they did continue to have an impact, as you've heard. And not surprisingly, what you're seeing on the screen here with the impacts in inpatient on 6% reduction there, the impact of the slower ramp up on inpatient surgeries of 25% of a variance there had a very significant impact on the results for the month. Those coupled with typical COVID related costs, which I'll talk about in a moment, really led to a result of an operating loss of about $4.5 million for the month. And as you remember, we are budgeting an operating loss, and that loss budget for the month was about $2.2 million for the month. So Jeffrey, if you could just move to the next slide, I'll talk through the finance dashboard for a moment. So again, just Tom spoke about length of stay. Certainly impacts cost. It impacts the number of staff, the supplies that we're using, and our ability to move patients through the facility. I think the one thing I will say about the month is that it is a significant improvement over January. You may recall that our month of January saw a much more significant drop in inpatient and outpatient surgeries, as well as overall results. Our length of stay was higher in January than it is in February. So we are moving in the right direction, but certainly did have an impact in the month of February. FTEs, we've stayed pretty close to the 3,500 mark now for a couple of months. That's been by design. We've talked about it here, but we're certainly managing FTEs through vacancies and attrition, but we're really focused on filling positions where necessary, especially in the clinical areas. So there's a significant focus there to make sure we're filling positions where the care is needed most, especially given the ramp up in volume that Tom spoke about a few minutes ago. The other thing I'll mention on FTEs that we look at is how many people are really on leave, in most cases COVID-related leave, compared to where we were last year. And interestingly, our budget variance is about 37 FTEs for the month. And we have about 36 FTEs of individuals who are out on COVID-related paid leave, higher than what we had last year. So it is driving, we have to fill those shifts, and it's driving part of our variance, but we're making sure the care is at the bedside. Next slide. Okay, so this really just does depict the story for the month, as I've mentioned. So you see our loss from operations of about 4.5 million compared to 2.2, and it's really driven on the revenue side, as we really had still continued to see the impact of the statistics that we just reviewed. And then, of course, on the next slide, you can see the impact overall of the first 2 months. And what I'll highlight here, not to go through all the numbers, but it really just does paint the picture of what really has driven the first 2 months. And again, it's the lost revenue related to the shortfall in cases that's really been impacted by COVID. And so you can see that at a $7.4 million variance, where we've really held the line on expenses for the first 2 months of the year, with a minimal variance to budget there. And then the next slide I'll highlight again. So this is our continual tracker. You're used to seeing this. I know we've reviewed it in the past, but now we're updating it monthly again. So $7.4 million of lost revenue, which really ties back to what you just saw in the year-to-date figures, but we still are incurring staff, supplies, purchase services, and other cleaning type costs related to COVID. The supply costs for the month were really driven by lab testing supplies, as evidenced by just the sheer number of tests that are being performed and need to be performed in the community. But it also does include, on the staffing side, our vaccination team and their hours and their time, as well as some supplies. So we're tracking and monitoring all of those in an effort to make sure that we can try to capture as much relief funding when it does become available as possible. So as of February 28th, through that first 2-month period, the impact of COVID for us is about $10.8 million just for the first 2 months. And then just a couple of updates I wanted to make sure I hit on the next slide. And I'll be brief because some of these, there really aren't too many updates, but on the CARES Act relief, there's still about $6 billion of undistributed funding that is left over from the first couple of bills that were passed. And they have not yet decided how to distribute those funds, and nor have they, HHS that is, really given any of the providers guidance on how to apply at this point. So we're still waiting on that. In the latest batch of money that was passed under the American Rescue Plan Act, we are investigating many different options and opportunities in there, but there aren't funds that are specifically earmarked for providers that aren't rural healthcare providers. So there were dollars set aside for rural hospitals, but not for specifically safety net hospitals or general providers. But there are other opportunities within that act that we're investigating, vaccination relief, community center type cost, reimbursement, things like that. So more to come on that, but we're looking at everything that we can possibly look at to try to get some funding. Let's see, the New York State budget, all of you I'm sure have been following along, but we're right in the middle of the process. As we were on a call with our association this morning, they called this week the biggest week of their budget process, and it does go into effect on March 31st. That's their timeline. And so right now where things stand is that the additional funding from the federal government is providing some additional relief to the state that may, as evidenced by with the report that came out this morning by their budget director, it may offset potential cuts that they were proposing to healthcare facilities. Obviously, the devil will be in the details, but at this point in time, we're following that very closely, and we'll certainly update you at the next meeting as to where that comes out. Payer contracts, I just wanted to highlight that we've kicked off our negotiations with our major payers here in town, but also are looking to some of our other payers on the Medicare side to make sure we have some coverage on those. And those updates I'll bring certainly back to the Finance Committee and the board when needed. And I think the last thing I'll note, just in terms of updates, and this is really just to round out the 2020 reporting and some of the actions needed there. So we talked a little bit about the audit. So now that that's approved, that will get filed within the annual report, as well as Tony said, uploaded into our government databases. In addition to that, we do file a certification that calculates the debt service coverage ratio with the bond trustee. Given the sheer loss that we did have this year, that calculated administrative ratio calculates below what's reported in the bond documents. So we're handling that through the requirements of the bond documents. And it's really, it calls for additional administrative tasks, like going to seek some additional approvals if we need to obtain new debt, and then providing a report of our plan to achieve the debt service coverage ratio. So just wanted to let the board know that reporting was in process, and we'll bring you updates again on that as necessary in the future. And so, John, that concludes my report. Happy to answer any questions.
Thank you, John. Would you update us on where you think the Medicaid situation is relative to the state budget? What at least as of today, anyway.
So as of today, the reports that came out that I was referencing yesterday, maybe I should back up. The executive proposal that came out really in January, that was from the governor's office, had significant cuts in Medicaid for all healthcare providers, including us. As of recently, a week and a half ago, the two houses within state government came out with their proposals, which both of which really rejected those healthcare cuts. And then the budget director this morning announced, or really yesterday, and I think it was publicized this morning, announced that with an additional $5 billion of relief, they were committing to offsetting the previously proposed Medicaid cuts. So again, the devil will be in the details and nothing is set in stone. So it is a fast and furious week down there as they finalize the budget. But as of this morning, there was a notion that the additional relief would be able to offset the proposed cuts for this year.
So at least the speculation is that Medicaid will stay intact and not further be decreased?
Yeah.
Medicaid, excuse me.
For the cuts that were proposed this year, yes. For the cuts that were put into place in 2019-20, I'm sorry, 2020-21, those cuts remain, but there is some discussion and advocacy efforts to try to alleviate some of those as well.
Great. Thank you, John, and congratulations again on that audit. Questions for John before we move on to committee reports on the budget, on our perspective going forward? I think for our next meeting, John, as we complete the first quarter, we'll have a better view as to how to project the end of the year. Would you think?
Yeah, I think our projection and our view will always be as good as our understanding of what's happening with COVID around us. So certainly we'll have a better picture, but there is always a little uncertainty as we look to project, especially these days with what's happening.
Okay. Other questions? Okay, just a couple of things from the with regard to the executive committee. I want to echo Tom's appreciation for everyone showing up to the D&I training. I think it spoke volumes about the commitment that we as a board have relative to what we were expecting of all of our colleagues and associates at the hospital. So thank you for taking the time to do that. And I hope you found it as useful and as informative as I know I did, and so many of you have made some very important comments about how important that all was. So thank you. I also want to remind you all that courtesy of Andy and Nicole Davis and Jody and Tom Quattrochi, tomorrow will be a gift gathering event at Russell's. So I would hope that you would all participate in some way and come by and both thank Tom and Andy and Jody and Nicole and help support that event. It's an important one as we go forward relative to the foundation. And having said that, Finance Committee, Mike Seaman, anything else that you need to report on, Michael?
No, I think Tom and John, explained all the details pertaining to managing FTEs and the COVID expenses and all they need to pay attention to in regards to the day-to-day operations. They've done a great job keeping the Finance Committee informed. As you can tell by the presentation, it's very clear. They paint a really nice picture in regards to how they're managing it. We see it every month in the Finance Committee, and it's carried over into the board. So kudos to Tom and John and his team to continue to keep the board informed and a very easy way of understanding the challenges and also the progress that we're making going forward. So kudos to them, and that's all I have to add. Thanks, John.
Thank you, Mike. Darby, anything further on audit that we need to talk about? Darby still with us? Okay, we'll move on. Ron Bennett, Buildings and Grounds.
Can you hear me now?
Yep, we can hear you now.
All right. We had a very short meeting this afternoon. Most of the projects have been either on hold or are minor. The in-house crew continues to do a lot of work. When we look at what they've done drywall and ceilings and reconstruction, upgrade light fixtures, asbestos abatement, floor placement. Really do a lot of work, and thanks to Jim and Mike that they had that directed. The ninth floor was our safe room, and that continues to be a situation almost finished. That's where the prisoners from the state come in, and I guess we're going to be visited by the state, and hopefully that will be approved. Just as a point, the exterior lights in the parking lot of the ED weren't working too well, and instead of replacing the fixtures, they replaced the drivers, and it looks like it'll be done. And lastly, the water damage caused by the sprinkler system when the window was left open caused between 5 floors. I guess that's being taken care of, and the cost is being negotiated. And that's our report. Thank you.
Thank you, Ron. Human Resources, Joe Gilia. Joe?
Nothing further to report, John. Thank you.
Thank you. And Gino on investments?
John has pretty well covered the finances. The only thing that I'll say is that the board resolutions that we passed, I think it was 1 or 2 boards ago, to bring in Loomis as an account manager has been very positive and has garnered some positive stuff for us. And with that said, I'll let John give you the rest of the stuff on the meeting.
Sure. The only thing I'll say is that the committee, besides the investment policy review and recommendation that was reviewed earlier, reviewed a recommendation from Mercer, who is our investment advisor, to slightly rebalance the portfolios that basically are holding some of our investable assets. So it's our insurance portfolios, holds about $78 million of investments. And the recommendations were really, currently we're at about a 70-30 fixed income to equity ratio. They opted for a recommendation to move to 65-35 based on just where fixed income is headed right now versus where equities have been headed. And it's a simplified way of basically saying that we believe and they believe that we can get a little more return without changing our risk profile within those funds. And they made a recommendation and added one small cap value index fund, which was the Vanguard Index Fund. And the investment committee approved that recommendation, and that will be implemented very, very shortly here.
John, have they started to talk about the potential volatility of the market relative to what will be the federal deficit? Have they started to address that at all?
Yeah, not necessarily the deficit per se, but part of the conversation in the committee that we talked about was just the concept of when and how much inflation will really impact the broader markets, and then how do we as a committee address some of those issues. Their view is a longer view, quite honestly, on inflation, and so and they showed some history on that of how it's kind of moved in the past. So they felt that how we are positioned in these specific funds are about the best we can do, given what we can and cannot invest in order to make sure we're addressing, additional return without taking on too much more risk.
What's the total value of a portfolio? Do you know offhand?
Our total value of the portfolio is about 300 million, but that includes our operating cash. So the days cash that you see that I've reported out on at these meetings of $130 million at this point is also included in that number.
Great. Okay, thank you. Any other questions relative to investment committee or policy? And I think to John's point, we approved the investment policy, so we'll at least good for another year. QI, Ron Chapin.
One item, we have a restart of our meetings this coming Thursday. We have a new agenda that I believe was distributed, and we would like all the people on the committee to participate, and we would like see some new faces at the same time. You can contact me, or you can contact Mary Ann Fix for details, but look to hear from you on Thursday. That's it.
Thank you, Ron. QI, Mike Hofford.
Yeah, thank you, John. We had presentations on kidney and pancreas transplantation, another one on oral and maxillofacial surgeries. Falls Prevention Committee also gave a presentation. Just wondering if Donna Jones wants to chime in on the 2021 ECMC QAPI plan that she talked about at the QI meeting. Donna?
Hi, I guess I would just add that in partnership with Great Lakes over the next 2 years, so from 2021 to 2023, they are, or we are establishing a quality institute. And that is in an effort to ensure we establish best practices or use best practices, also using research to guide our decision-making, to guide our policies and our procedures. There will be involvement from representatives of each of the Great Lakes hospitals, including medical staff. So the remainder of 2021 will be used to really develop the institute with an anticipated implementation date of January of 2022. And that is all, unless there are any questions.
Questions for Donna and or Mike?
Thank you very much, everyone.
Thank you.
Thank you, Mike. So that completes our agenda. Just actually two last things from my perspective. I think the board ought to know, and I've mentioned this in the past, Tom Quattroci's work on behalf of this community's COVID response has not only been remarkable, but has been well recognized, not only in Western New York, and quite frankly, some of my government friends have been telling me about how important his input has been right across the state of New York. So Tom, on behalf of the board, I want to thank you for what I know has been an absolutely thankless, time-consuming, at times mind-numbing exercise, but you have acquitted yourself on behalf of the hospital tremendously well, and certainly personally. So thank you, and know that the hospital has benefited from the work that you have done and the manner in which you have gone about that work. So thank you, and I'm hearing it everywhere I go. So well done, and hopefully we can see the light at the end of this this long tunnel. So thank you.
More vaccine coming, so.
Let's hope. And so with that, some of you who were at the Thursday D&I training saw Andy Davis make a long court shot, basketball shot that he promises to duplicate tomorrow at Russell's. So I would hope, I don't know if he'll ever be able to duplicate that, but I would sincerely hope that you can join us there for the party that's being hosted by Tom and Andy and Nicole and Jody. So with that, for the good of the order, unless there was anything of old or new business matters that we need to address, are there any? I'm happy to entertain a motion to adjourn. Thank you, Chris O'Brien. You can go back to basketball. Seconded by Congressman Quinn. Thank you. All in favor?
Aye.
We are.
Aye.
Thank you, everybody. Please stay safe and thank you again. And we are adjourned. Good
Have a
night.
good night, everybody.
Good night.
Have a good night, everyone.